So you think you might have a tendinitis or tendinopathy or something going on with your tendon, or you might have had it previously and now you're trying to get back into things, but you want to learn a little bit more and make sure it doesn't happen again. Let's go ahead and dive right into all things tendon health. But first, we're going to talk what specifically is a tendon and what makes it different than other connective tissues and what makes it different than your muscle itself. So you have essentially passive stabilizers, which are like your tendons, your joint capsule, ligaments, things like that. So those are passive stabilizers. They don't contract. Then you have your active stabilizers, which are your muscles. All of these things work together to create some stability around your joints, and then the muscles help you move. Basically, the tendons connect the muscle to the bone and therefore allow you to move, because if they weren't attached to the bone, then you couldn't actually move, right? So that's kind of what specifically a tendon is. It's connective tissue. So what can you do to optimize tendon health? Well, first, the most common thing that people think of when they think about tendon health is eccentrics. So essentially an eccentric muscle contraction is a type of muscle contraction. So you have concentric, eccentric, and isometric muscle contractions. The concentric, so if you think about a bicep curl, this is the easiest example. So you're here, you curl up, and you curl down, and yes, I'm sitting on the floor, okay? Don't judge me. So you're here, concentric, your bicep muscle is shortening and moving. Isometric is if I just held it right here and didn't move. So if you think about, this is gonna go on a little tangent, but going out to the side and coming in, the exercise with dumbbells does absolutely nothing. You're just doing an isometric contraction of your bicep. You're not working your rotator cuff, just grab a band and go outside. But anyway, so that's an example of a terrible exercise, don't actually do that one, but it is an isometric biceps exercise. The eccentric part is you start at the top and you go down. So that muscle is contracting, but it's lengthening. So you can also think the slow lower part of your pull-up or the going down part in your squat. When you come up, that's a concentric in the squat. When you pull up, that's a concentric for the lats, for your pull-up. When you lower down, that's eccentric. So concentric, shortening and contracting, eccentric, lengthening and contracting. So they're both contracting, that muscle is working, but it's lengthening as it's working. That's gonna be the most optimal for tendon remodeling. So if you're working on your tendon health, go ahead and include a little bit more eccentrics of the muscle that you're targeting into your training. And keep in mind that this might increase some soreness as well. Eccentric training does increase your soreness a little bit, but so be aware of that and don't get too scared of it. Another thing to do is you want to ensure that muscle has the proper length. If that muscle is short and tight, then it can increase the pull on that tendon. So you want to do some stretching for that muscle. Rule of thumb is to stretch for about a minute per major muscle group. So specifically, again, if we're talking about your bicep, you're gonna stretch your bicep coming down and back, and you can kind of stretch it back that way when you're holding on to something. So you can do 2 sets of 30 seconds, you can do 4 sets of 15 seconds, you can do a minute, depending on your preferences. I typically go a little bit longer than this because sometimes when you count, you just go really fast. So I'll typically do 3 to 5 sets of 30 seconds per muscle that I'm targeting. Also consider low load strengthening at end range of motion. So again, going with the bicep example, you might be doing a low load isometric at end range. So if I'm doing end range elbow flexion, this is typically not necessarily a super common exercise for like your shoulder or anything like that. If my chest is supported on a bench, my arm is gonna be dangling down, right? So I'm at like an incline bench, and then I'm gonna grab a weight in my hand and I can hold it here at the top. So this way my arm is still working because it's here and I can hold it there. I can even do little pulses there. You can probably see this a little bit more often with the hip with like a 90-90 internal rotation. So coming here and doing this here, I'm working end range hip strength into internal rotation. So that's an example of an end range strengthening exercise. This is typically low load because it's harder. So higher reps, lower weight, more endurance focused helps that tendon as well. And then also consider the pace that you're doing your strength training and that you're increasing your weight or resistance that you're using. You want a gradual increase so your tendon can adapt to that new load. Not necessarily increasing every single week or every single time that you're working out, especially if you're more advanced. Sometimes beginners can definitely get away with that as they're building the neuromuscular pattern versus that pure strength. But when you're working that pure strength, it does take 6 to 8 weeks to really get those changes in those muscles. If you increase your strength too quickly and you don't give your tendons time to adapt, that can definitely result in like tearing of a tendon or things like that. Like I've heard people, typically steroids are involved honestly with this, so I wouldn't be too terribly concerned about it with specifically like a pec tear, for example, where they're benching and they're able to increase their weight a whole lot in a short amount of time because of the muscular adaptations, because of the steroids that they're using, but those tendons are not able to keep up with that demand, and therefore you get an injury. So keep that in mind. The progressive strengthening is also important. Then you also want to consider the muscle and joint balance around that joint. So you want to make sure your muscles are balanced, but I do have a whole entire video on that I'll go ahead and link over here for you. Let me know if any of those things were helpful or if you have any questions below.